In the second part of this lecture, we're going to talk about X-rays and the related medical technology of CT scans, as well as a treatment type of technology called smart insulin pumps. So to review what we talked about light in lecture 10 is that light is both a particle and a wave. So the particle part is not as important for electromagnetic radiation. We're going to specifically be talking about the wave part. And just like sound, a light wave has two different parts that we can talk about by looking at the waveform. So we have the amplitude, which is how far is between the crest and the x-axis. And so this is, like in sound, related to intensity. And so we have brighter colors versus duller colors. And then we have wavelength, which is the inverse of frequency, which is the color that we see. So long wavelengths correlate to colors like red, and shorter wavelengths and higher frequencies correlate to colors like purple. But of course, we also have things that are outside what we can see. We also have light at different speeds, and light speed can vary depending upon its medium. It's about 3 times 10 to the 8th meters per second in air. And so this is the electromagnetic spectrum that we're talking about. We have increasing energy this way and increasing wavelength this way. So energy is the same as frequency. So higher frequency equals higher energy equals lower wavelength. Here is visible light. So out of all the electromagnetic spectrum, we can see very, very little of it. And so starting with the lowest energy, we have AM and FM radio, TV, and radar, and then we have infrared, again, right under the frequency that we can see, and ultraviolet right over the frequency that we can see, X-rays, which are even higher energy than ultraviolet, and gamma rays. And since these are increasing energy, we can also think about these as the higher energy being a little bit more dangerous to us. And that is because the higher energy something is, the more that it is going to interact with matter, and so potentially cause problems. So there is no danger at all associated with radio or TV or radar, because these are really, really long wavelengths. It's really difficult for them to actually interact with any matter, no matter how tightly packed that matter is. Again, visible light, we don't really worry about this. And visible light, of course, can't penetrate our bodies at all. Same, it can penetrate a piece of paper. And so if you hold a piece of paper out in front of the sun, you have none of that light is getting through the piece of paper. You have a shadow on the bottom, right? Makes sense. However, once you start getting into these higher energy rays, they're actually getting through things. And so, like ultraviolet light, as we know, can get through the skin. And we know that because it can cause skin cancer and cause mutations in the skin because it gets into the skin. So visible light can never get into the skin. Ultraviolet light um, can get into the skin and begin to cause mutations. X-rays get further into the body, right? You can have X-rays that get all the way through the body, that come through the body, and gamma rays even more so, even higher energy. So this is why you can't have something like infrared used in medical imaging, because it doesn't actually get into the body at all. You have not enough energy to get through anything that's solid, whereas you start being able to with these higher energies. We're going to talk a little bit about how X-rays are formed, and I don't think it's super important that you understand all of this, but just so you have some kind of idea. So initially, this is a copper atom, and X-rays are formed by flinging an electron out of its circuit, and the energy that causes, the energy that change causes. And so we're going to talk about this as a copper atom, and you have a beam of electrons that smash into a copper atom like this. And the electrons in the S shell, this very close shell to the nucleus, get flung out of their orbit. And then the atom becomes unstable because you don't have the number of electrons that you need in this shell. So since this is the most important shell of electrons, then you have a electron from the p orbital come down to replace this electron to make this a little bit more stable. And so this is what your X-ray is coming from, this movement from the p orbital to the s orbital of the copper atom. And so in our X-ray machine, you just have a stream of electrons that are going at a dense metal like copper or sometimes gallium. And this beam of electrons will eventually boot out an electron from this inner orbital and causing an electron to come to the inner orbital from the second orbital, from the p orbital. And this change causes a really high energy, high frequency wave called an X-ray. So this is how X-rays are formed within an X-ray machine. Again, this isn't super important to know, but I just wanted to give some context. The color is dependent upon the number of electrons and the density of the material. So the more dense a material is, the more likely that a wave is to hit something. Just like we talked about in water versus air. Similarly, the more electrons there are in a particular atom, the more likely a wave is to hit something. And so this is why when we talk about X-rays, we normally think about really dense materials and materials that have a high number of electrons. So specifically, we think a lot about calcium. So we think about X-rays being used to image bones and to image teeth. And the reason that they image bones and teeth is because they both have a high level of calcium. And calcium has a higher an atomic number and higher a number of electrons than almost everything else in the body. The majority of the elements in the body are hydrogen, carbon, nitrogen, and oxygen. And so these all have a lower atomic number and fewer electrons than this calcium. And so if you have an X-ray going to calcium, it's going to be more likely to hit something than if you were going into a hydrogen or carbon atom. So the greater number of electrons, the greater likelihood of making this shadow that is then going on to your eventual screen. So let's look at some x-rays. So as we said, it's really good for bones. You can see this bone is obviously much denser than everything around it. And so you can see the breakage in this bone. Same with teeth. This high calcium is creating a shadow. This is where our x-ray can't get through. And so creating a shadow that is visible because everything around it is probably carbon and nitrogen and helium based, because you have this muscle here. We can also use for things like pneumonia. So you have something that's a little bit similar to an ultrasound, where we have a greater density in the lungs when you have pneumonia. So the pneumonia itself is more dense than the lungs are. It's also why you use tuberculosis. You use x-rays to diagnose tuberculosis, because you have this higher density of the bacterial infection in the lungs than the lungs themselves. And so you can see that infection really clearly. We also have computerized tomography, which is essentially where you take a cone of x-rays and then shoot it all around the body, and you bring the body back and forth through. And it's super concentrated, and because of that, more detailed than x-rays, because x-rays just show you, as we see here, one point in time and one angle. So a CT scan is just a bunch of x-rays that go into the body and give you a more complete vision. And so what is that useful for? Things like locating tumors, because again, you have a higher density in the tumor than you have in the cells around it. Finding clots, similar to in the ultrasound, and also guiding surgery. So CT scans are basically just high powered x-rays that can be used from a lot of different angles to make a more complex and complete image than an x-ray can. Finally, we're going to talk about smart insulin pumps. And when I say smart here, I mean that they are working on some pretty high technology. So they're working with Bluetooth technology. And there are other kinds of insulin pumps that we'll touch on briefly. So we looked at this image about the treatment of diabetes. This is right around the time that insulin was discovered as a treatment for diabetes. And so this is the same person before insulin who has diabetes, and after insulin, about 4 months of treatment. And so you can see that her body is able to now process the food that she eats, and she's able to actually absorb that and look much more like a healthy child and be a much more healthy child. So insulin as a treatment has been known about since about the 50s. Smart insulin pumps are a much more efficient and much more easily monitored way to administer insulin. So they respond to spikes in blood sugar and track the blood glucose all the time. And so you'd have a monitor like this somewhere on the body, and you have an insulin pump, and the monitor and the insulin pump are communicating with each other. And when the blood glucose monitor tells the insulin pump that blood sugar has raised, say that somebody has eaten something, then it would administer more insulin. And if, say, somebody's exercised and is hungry, then it would administer a little bit less insulin. It administers insulin directly into the bloodstream and helps regulate blood sugar the same way that a pancreas would if the person had a pancreas. So it's kind of, it's not a perfect substitute, but it is a kind of substitute for the negative feedback loop that we talked about. So let's walk a little bit through why this is important in type 1 diabetes. So again, the difference between type 1 diabetes and type 2 diabetes is that in type 1 diabetes, the pancreas isn't working correctly. So the beta cells in the pancreas are not giving off insulin when they should. And so it's this pathway that's blocked. So the pancreas is not giving off insulin when it should to stimulate a glucose uptake from the blood. Type 2 diabetes is different. This is not where the X is. This is not where the problem is. So the pancreas can be putting out insulin as it needs to. However, there are problems in insulin receptors on tissue cells. And so they are not able to take that glucose up from the blood. So the problem isn't more insulin. And so as you expect, we use an insulin pump. We just administer more insulin in the type 1 diabetes case because there's nothing wrong with the tissue cells, and not in the type 2 diabetes case because the tissue cells are the problem, not the amount of insulin. And so, of course, an insulin pump can't change your tissue cells. It just changes how much insulin is in your body. So this is why we only use insulin mostly for type 1 diabetes. So let's go back to this negative feedback loop that we talked about. We have the stimulus that the person eats and the blood sugar is high. Beta cells release insulin into the blood. Tissues take up glucose. Liver turns glucose into glycogen, and blood sugar drops, right? This is the normal way that this cycle happens. And so if we then look at a negative feedback loop for a diabetic who's using a smart insulin pump, then the person eats and blood sugar gets high. And it's not the pancreas that senses the blood sugar raise, but it's the pump that senses the blood sugar raise, or that sensor. And then the pump releases insulin. So then tissues are able to take up glucose, and the liver turns glucose into glycogen, and the blood sugar drops. So you see that this looks essentially the same for non-diabetics and diabetics who have smart insulin pumps. And so diabetics that closely manage their blood sugar and closely track how much insulin is in their blood are able to live life very similar to non-diabetics. I wanted to draw your attention to on the Moodle site, there is a little bit of extra practice that just lets you review the different types of medical technology that we've talked about today. It's a good review mechanism. Finally, I wanted to take a minute to just thank you all. I am sad that we have not been able to meet because of this course, but hopefully one day we will meet, inshallah. I have had a really great time teaching it, and I really hope you've enjoyed it, and best of luck on your final.